All right, welcome back to Basically EMS. Got a couple OGs with the table with me today. We got Justin and Wade, who you guys have probably met before. You guys have been on the podcast before, so
Yeah.
no need to go through the whole resume again as normal. Today we're going to be talking about the kind of the difference between an experienced provider and a new provider, and kind of what sets that new provider apart. And maybe how like our experiences as we got our years under our belt, and how we started to become better providers as we got that experience. So anybody have anything they want to jump right into and talk about?
I mean, the first thing that immediately jumps to my mind is like the breakdown of school medicine versus like dosing and versus like street medicine, right? Like the common example, aspirin. If you ask a student 324 milligrams, like they're going to have that stamped to their forehead. You ask a provider out in the field, hey, how much aspirin do you give? I give them 4 of those things. You know, it's just quick, easy, concise, dumbed down, I almost want to say. Like if you get rid of the intricacies that cause mistakes for the most part. This is an easy, quick one that I've seen.
Yeah, I mean, that's fair. And I think that also comes a little bit with like where you work, because then
Right.
like NREMT, whatever, a new person's going to know those broad stripes of like, whatever it is. And then when you get to where you have your actual equipment, you're going to know more specifically that equipment for those kind of simplifications of things like that.
Mm-hmm.
But yeah, that's definitely, I mean, I definitely had an experience where like, yeah, what's the dosage of this? A vial? I couldn't tell you, but I know I give this much.
Right.
I know how to draw it up correctly.
Right.
But I'd have to go reference my protocols maybe for the exact whatever, or like how, what's the mechanism of action? I don't know. I know what it does, but I couldn't tell you the mechanism anymore.
Right.
I know when to give it. A whole lot better than somebody that's brand new, though.
Right. So I got one this is like a question I love to ask more experienced providers. When it comes to pain control at the medic scope, do you notice that one medication works better for certain complaints? Like I've always heard like, well, morphine's my orthopedic injury, or fentanyl's my orthopedic injury because it's faster, but they always make an argument one way or the other. I don't know. Do you guys you ever see that?
I think it's really comes down to like more of the why of what you're trying to accomplish, right? Are you trying to accomplish taking the edge off, pain control, movement, right? Like I think I always break it down to like, what is our ultimate goal, right? Is it to get person from point A to point B, and it's gonna be a painful move, so I'm gonna try to medicate that way. And all they're thinking about like other complications with that medication, or am I gonna do more of like hey, this is gonna be a good medication for like the transport and a more long lasting. I always kind of look at and just training people is like understand why you're giving that drug and like what dose do you want to achieve and what do you have the best success rate with that dose. Because a lot of times people will just be like, I always give this and that's it. Like I think you should have, if we're going to be practitioners, you have to have a range of, hey, I want to give 2 milligrams of morphine because of X, Y, and Z. I want to give 4 milligrams of morphine because of X, Y, and Z, and kind of be able to articulate that. And that's how I've always kind of approached like pain control, especially with training new people. The book says this, but you're going to have to experiment a little bit too. You don't want to give, 10 milligrams of morphine, but like you want to see like, what does 2 look like? What does 4 look like? And really get to be comfortable with those different dosaging, because they're going to require different things and things you want to do to help the patient take the edge off.
That's fair. I mean, I know we're basically EMS, but we're a little above scope right now. But one thing that I notice is from a paramedic perspective is the fear of drugs a little bit. Not so much fear, that's not quite the right verbiage, but like you were just saying, like what's the why? Try 2, try 10, or not 10, but see how that progresses. Because in my experience with like students and even some trainees that I saw were like, I want to give 2 of morphine because 5 is a scary number to start with. But then come experience, it's like, oh no, I start with 5 because that's just the baseline. That's the minimum effect, and like that is just kind of an experience thing with that as well. But it's interesting.
You see that at the basic scope too, right? Like I'm sure, Justin, you've seen this of EMTs that are terrified to give nitro because they've heard that nitro can drop blood pressures. And so, they're not sure about that. So, you see that at all the different levels of scope of maybe being nervous about doing the wrong thing, like handcuffing you to not do the right thing because you're so scared of, of those things. Because we do kind of bash people over the head with some of these possible side effects or issues, and sometimes people are paralyzed because of that, not wanting to do the right thing. So, that's definitely something that I mean, I'm sure I experienced at some point, especially as a new, as a new paramedic more than a new EMT, of like, like the first time I ever saw an RSI was on the side of the road as I RSI'd a patient. I'd never done it in internship because I came from California, where that's not a scope, or not within scope. That's a flight medic skill only. So, and that stuff is terrifying, sometimes it's the first time I pushed ketamine, first time I pushed a paralytic was side of the road, like all by myself, just doing it with no FTO or anything. I'd already been cleared. So it can definitely be a thing. And that's where you just kind of have to, I feel like, just trust your training a little bit, and be ready to kind of move on your feet if you have to. Like know the possible negative outcomes and be prepared for those and watch for those, but still treat within your scope. Yeah.
And even like extending on that, elevate your training to how you need it to perform, right? If you're just kind of half butting it, if you're just, you're not taking to the highest intensity you can, make it realistic, right? Like high acuity, low frequency things. I mean, at the basic scope, not that often, you don't see it, but like a Sager splint, like you're the new person. We expect you to know how to do that, because I sure forgot, and not now, but once upon a time. Yeah. It's just one of those things, you got to be prepped to do. That's fair. Fair point.
Well, I think there's a transition from going from school to out in the field too. And a lot of it, we in school, like in EMS school, in EMT or paramedic, we train you for the worst case scenarios, and we train you to think fast and quick and come up with all these solutions. But when you get out there, you might have a lot of time and there might not be a solution. And having, embracing the pause. I think when you kind of grow into EMS, you learn how to master the pause of like, okay, let me think about this. I don't have to be moving so quickly. And, I have more time to think about this. What kind of plan do I want? I see that a lot with people from going from paramedic school to transition into like the field, is they've been trained for 2 years of RSIs, critical calls, strokes, and then they get on someone who they're like, they're not having a stroke, they're not having an MI. Crap, what's going on? And they have to learn that social part of being in paramedicine. I think that's honestly one of the hardest transitions I see. People coming from school to the field is actually learning how to do that social aspect, communicating with the patient, relating to a patient, navigating it. Like I always tell people in EMT school and paramedic school, is like, you have two objectives. You have to control the scene and control the patient. If you can't control the scene, the patient goes. If the patient goes, then the scene goes, and you have to kind of be a master of that. And it takes time to actually put all those things together. But if you see people who've really mastered this profession, it looks like an art form. They are able to do both equally and look like they're not even having any effort into it.
Yeah, it looks easy. Yeah, that's fair.
Because they're mastering the pause. Yeah, I'm gonna trademark that.
That's actually a good one. I've never thought about it that way, like that verbiage. Because when I had a couple of students in particular, like, when you're loading them in the back, that constant, okay, I'm going to hop in the back with you. I'm going to get all loaded up. I've literally grabbed the belts of students and like, nope, we're walking around the side. And they're like, well, I can just get in here. It's like, take 5 seconds, think for a second, buy yourself little time, master the pause, buy the time to think so you can put a good plan in. And, that's one thing you see is just the rush, right? Like they're rushing things, and it's that, hold on, step back, slow down. We're going to be okay. Just think about it for a little bit longer.
Yeah. Kind of like you were saying, I think we, by the nature of it, do a bit of a disservice to students because, there's going to be, you can win or lose every scenario generally we're going to give you, and that's just not real life. Right. I mean, most of the time it's going to be low acuity, even maybe at the paramedic level where like, is there really anything I need to do right now? Are they dying in front of me? No, they're not. And that's just, school is like, they're having a heart attack, they're having a stroke. You need to find those things and recognize them. If you don't, you didn't do what you're supposed to do. And that's just not conducive to actual field work. Like, just like you were saying, it's that human aspect we don't teach in school. And I think that that's what's really hard, especially I think, as technology has progressed, that people just don't have as much interaction with each other, especially post-COVID, right? Like, I need groceries, I'm going to go on my app and it's going to be delivered to my door, or DoorDash. I'm not even going to go through it. Drive-thrus are too much work and too much social interaction for
I got to
people
leave.
now, right? Yeah, I'm not going to do that. And so, you have to sit down across from somebody who's 80 years older than you, whatever, and have a conversation for 30 minutes to the hospital because their toe hurts,
right?
Or their tummy hurts, or whatever it is. It's low acuity, and you need to have that human interaction that we just don't we just don't teach. And then, like you said, it's an art form. Like you start to get really good at that, and it just looks effortless. And there are times where it feels effortless when you've done this for a while. Everything just feels good. And there's definitely the times that we don't teach EMT students specifically about, like, I don't feel like we talk about it at all, where everything, no matter what you do, just feels wrong. Everything, and you have to have the mentality, and I think this is like a senior thing too, that you've done it for a while, that like, I got them to the hospital, they didn't die, they didn't get worse, I did my job. Even though there's sometimes where, I mean, from the first, like, hi sir, my name's, and the like, and from there on, just something feels off. I'm sure you guys have had that experience where everything just falls the wrong way. But as long as you can recognize you got them where they're going safely, then you did the right thing. But sometimes, like, man, everything that you did just feels wrong.
I was literally just talking to a student about this, about like, you got to kill that perfectionist in your head. And I considered myself a perfectionist for a long time, and it's easy to do in school, right? Like, you're shooting for 100% on everything, and then when you get out there, like, you're right. The way he interrupted me when I said my name, and that threw out my whole flow. And now I don't like how this is going. And then, you get to the hospital and you're just beating yourself. I literally used to do that when I was early medic. I was just beating myself up, like, well, this went to garbage and that went to garbage and this didn't go the way I wanted. And it wasn't until I had kind of that slap me in the face moment from an FTO of like, are they alive? Are they at the hospital? Yes, you did fine. And fine is good enough sometimes, and it's going to break a lot of brains to hear that, but that's kind of the reality you need to face.
80% is still passing.
Yeah.
Hey, so, as I tell all of our students, right? Like, what do they call the person who graduated last in medical school? They call them doctor, right? Like, we need to, we want to try to attain perfection for sure, but there is no perfection in what we do.
It's not real.
And if you can't, I don't know, I feel like if you can't live with that and start to embrace that, then this maybe isn't the right job for you.
Yeah.
I always tell people, especially when it comes to experience and how to gain experience, it really comes down to time and effort. You have to put the time in, but you also have to put the effort in too. If you're not putting the effort in, you're never going to be able to have that experience to make those decisions. So I think when starting out with your career and stuff like that, you kind of have to look at it two things. Like, you have to put the time in. You have to see cardiac pain, like chest pains. You have to see strokes, and you have to see multiple of them, because that's how you get that experience. Is it takes time, but it also takes the effort of going back and be like, how can I improve? What can I do better in patient care? And that's where, the people who have really mastered it, they have put that time and effort into it. But I always say, like, you have to do both equally. You can't just put time in and expect like you'll just have this good experience. You have to put the effort in on top of it. And that's where I really look for, like, especially new people coming in the field, are they willing to do that and do the time and do the extra things? And really the people I see that really stand apart are the people who are willing to do the 10% extra. Not the 120%, the 10% extra of, oh, I'm going to say this. Oh, I found this thing. I'm curious. They're always curious of how I can get better. And I think that's a really good quality or a trait to have in EMS is a curiosity. I mean, that's what I love about EMS is the curiosity of taking care of a patient. Be like, can I figure what's going on? Can I make a difference? Like, I'm always approaching every patient as very curious. That way I can help them, and it keeps me engaged too. If I'm curious and I have the action of I want to understand, I feel like, hey, I'm invested into this call, versus if I'm not going to be curious and I don't care, well, I'm not going to provide the care that I want to provide for that patient.
I very specifically remember I had an FTO as a medic, and he wasn't my normal FTO. He was just filling in for the day. But you probably wouldn't know him. Justin wouldn't know him. He went on to become an RN. He's not on the ambulance anymore, but I think he was like a 15+ year medic at that point. Right. I'm like a brand new medic. And I ran a call, I teched a call, and afterwards I was asking like, oh, what could I have done better? Asking that kind of thing. And we kind of talked about it. And then he ran the next call, and we get back to the station. He's like, hey, do you think there's anything I could have done better there? And like, that was like, it's a simple thing, but that was profound to me of like,
humbling.
he's asking me as his trainee what he could have done. Like and it wasn't put on, right? He genuinely was like, how can I be better? And I'm going to learn from everybody I can. So, and I think that's another thing that separates, the long-term good at this job people is, like you're saying, they're just always curious. They want to learn everything every time. They're always looking for how they can improve, because you're going to run 5,000 of the chest pains that look the exact same, but every single time you can get 1% better.
There's always something to take away from a call. There was one FTO who really pushed that in my mind, and it was something that's like, duh, it's a very obvious thing, but it's another thing to like really acknowledge that moment. And sometimes the takeaway is like, oh, I'm never doing that again, or if this happens again, I'm calling PD sooner, like little things. And yeah, that's 100% being curious and having the ability to dumb down your own ego for just a second and be like, oh, I'm not a paragod. I'm pretty close, but I'm not a paragod, right? Well, I'm pretty close. I don't know about you guys, but
Justin has ascended.
Yes.
He has achieved.
Yeah.
No, and I kind of add on to it. Like, I'm a firm believer there's no self-made EMTs, no self-made paramedic. Everyone has, made mistakes, but also people have helped them to get to where they are at. So don't feel like, and if you have someone who's training you and they think they're perfect and they can't do any wrong, they're probably not the best ones to listen to that advice. The people who have mentored me and got me to where I'm at now is people who are like, oh yeah, I don't know that answer, but that's a good answer. Let's look it up. I mean, they're always willing to learn and be curious and to basically be an advocate for the profession, right? I think that's what we have to look at too, is you want to be good for your patients, but you also want to be an advocate for this profession. If we want to keep on growing this profession, we also have to remember, like, we're not paragods. We're not all these people that, are perfect. Like, we're human beings trying to take care of humans. And I feel like with that kind of mindset, right, we have an opportunity to do better for the next generation too, and actually create a safer work environment. I mean, when I started, it was basically told like, hey, don't do what I do, but do what I say, right? Like, hey, I'm going to break all the rules, but you have to be perfect. And I'm going to hold you to this unrealistic standard. And, if you screw up, I'm going to make sure you feel horrible about it. I think now we're going into more of a culture of, hey, we want to hold you to a high standard, but we need to, get you to a high standard. And how can we talk about it? How we can help you achieve that standard versus you did this one thing wrong. And I always believe hindsight's always 20/20, right? Especially as being an FTO, I think it's easy for FTOs to see someone screw up and be like, I would have never done that. And be like, I probably would have done that. But, because we get to see the outcome, right? Like, as an FTO, you have to really watch out for that, like, oh, they did it wrong, so I'm going to punish them or I'm going to yell at them for not doing that, versus like, you know what? Based on what they saw, that was probably an appropriate thing. It just didn't work out that way. But sometimes as FTOs or trainers, we look at it and say, well, you did it wrong, so let me tell you why I would have done it perfectly, right? And it's easy to, I think, in people's training mentality to be like, if you act like that the whole time, you're not really helping anyone else out because you're just justifying how you would have done it perfectly without actually boots on the ground actually doing it. I always liked when I was getting trained and I would do a chest pain call and maybe screw up here and there, and then my preceptor or my FTO would be like, I'm going to run a call too so you can see it also, and I can learn that much, right? I think it's a partnership, right? Like, EMS is a partnership, and I think education should be a partnership that can be nourished and be able to like provide that better patient care and also that safety of, I don't know it all, right? I haven't seen 1,000 chest pain calls yet. I've only seen one. So I would like to see how maybe someone does it and how they've, flow. And I always tell people, like, look, you don't have to do exactly everything I do on a call, but just take the pieces that will work for you, right? This is your practice. Build your practice. Don't build my practice. I'm not going to be around like watching you for every call you go on, but figure out how to build your practice. Take the good things that you can actually add to your practice, and guess what? You'll be a better provider that way too.
Oh yeah. I mean, I'm sure we've all had an FTO that we didn't entirely get along with, and it was a long, difficult road. But like, kind of diverting from our topic a little bit of like, how can you be a go-getter if you have a hard FTO? Like, someone's like, listen, just from a moral compass, we are not on the same page, and like you were saying, what I was going to say to that is take things from other people and the respect, obviously not physical things, but like take the things that you like and they don't like. Like, I used to watch doctors.
Only pens
or left shoes.
Just steal their stethoscope.
Yeah. The earbud of one stethoscope. Yeah. But like, I used to watch doctors. This sounds really bad. I used to steal assessments from doctors, watching them do things over and over and over. It's like, oh, that was really smart. I'm going to start doing that. Or like, the tacky, you learn a new test. And I was like, well, I'm going to try it out on this kidney pain. I'm going to give you the tympanic test. Do I know what I'm looking for? No, but I mean, I can glean something from it, And so having that ability to just self-start of like, okay, this is clearly I'm not learning how I want to learn from this person. How can I make this the best experience? Because I definitely had one FTO that was like, I don't want to do this job anymore. You're making me want to quit this. And it wasn't until I had that realization of, I need to just own what I can own. And, this guy is going to be a thorn in my side for the next few weeks. I can get past this, right? Can I be mentally tougher than somebody who's not helping me? Which is always a tough uphill battle. But if you have the right kind of mindset, it's not impossible.
Yeah, I had the similar experience. Like I was like Google searching, how much does a dispatcher make? You know what I mean? Like I was pretty done with one of my FTOs, and for me it was just having like a survival mindset of like I gotta just survive this, and don't let that taint your view of this job and of this field and of the people in it, because that could be really easy, especially if you're brand new. Like if I was a paramedic trainee. If I was an EMT trainee and I was going through that, I probably would have just left, right? Like, it wasn't a respectful environment. It was just a really bad place to be. And that I knew that was not how it normally was. So I was able to kind of like, how we went through it to be like, it ended up being 7 weeks because it's always, longer than normal when it sucks. But it's usually like 6 week rotations with an FTO where we worked. And, it was like, I just got to get through 5 more weeks. When I'm done with 5 weeks, then I can reassess and reevaluate and just kind of survive.
Right. I think it's good to remember who you want to be and who you don't want to be. I think you have to always look at that. I remember one of my first ride-alongs as a paramedic, the guy who was training me asked me all these questions that I probably still don't know to this date, because they were just, I felt like maybe some of them were made up, or he was just showing how much he knew and how I didn't know. And I had the horrible experience. And I left being like, oh my gosh, because he basically told me, drop out of paramedic school, you'll never be a paramedic, blah, blah, blah. And I just felt horrible. I was like, am I making a wrong career choice? And I could have totally derailed me. But I took some time and like, but is that someone who I want as a mentor, or someone who I want to be like, that's EMS? And it wasn't. So I decided I'm going to keep on doing it. And then finally, after, 16 years, I was,
nailed it.
Yeah.
Yeah. Sometimes I have found, you guys have probably had the same experience with, like, some people get into the training role for the right reasons, that they want to bring up the next generation and everything. And some people get there to prove how much more intelligent they are than everybody else.
Or just a promotion step.
Or, yeah, that's a whole different path of bad. But just kind of what Justin was talking about, if some people that like their self-worth is wrapped up in proving that they're smarter than the students, or they're smarter than whoever. And that can be really, really hard, I think, as a trainee, if you have that person who's just constantly not to build you up, but to break you down by being like, oh, go change the blinker fluid on the ambulance. You know what I mean? Like giving you some stuff that just maybe not even real, like you were saying, like just a made up thing to make you feel stupid. And they do that purposely because it makes them feel better about themselves. And sometimes hopefully you can recognize that this is not, that's what this is, because we've all seen those people. I think that like that's what they're doing, is trying to bring you down to build themselves up, when it should not be that way at all.
Oh yeah. I mean, another difference between an experienced and a new provider sometimes is how thick is that salt layer, and like sometimes they've been in it a while, they're tired, they're grouchy, they're grumpy, they're salty and jaded, they don't want to be here, but they've made a life choice that they can't really leave. Don't let that affect you, right? Like if you're someone who's curious, don't let that person break you, because you can 100% be successful in this job. And I would venture to say we're all probably examples of that to a degree, of like, this guy tried to ruin me, but respectfully, screw him. I'm going to do what I want to do, and I know what I'm doing, and I can get there.
And it's hard to navigate, especially as a new like EMS provider, because you have the stress of the calls, but then the stress of like performing and trying to build your reputation and try to show competencies. And I think the biggest thing is like, it just takes time, and you have to always kind of look at the little victories, right? Like I always give an example of like, when I do EMT courses of like, hey, your first call, you might just pause and maybe say your name. Or maybe you don't say anything and you just drool a little bit and you're like, please help, right? And your FTO comes in and says, hey, what hospital you want to go to? But then next time you say your name, next time you say what hospital, you ask more questions, right? You have to go through the gauntlet on every call, kind of being new, but don't think that that's how you're going to be as a provider. You're just going through the process, right? You've never been to multiple homes in one day. You've never seen this or that. Like, it just takes time, and it sucks that, you have to experience it, but we're glad for punishment, and we always like to come back, right? We're the people who like say, don't touch this hot plate, and we're like, I'm going to put my face on it. You can't tell me what to do, right? Like,
Yeah. So kind of in the same vein too, I feel like the salty guys, like there's that jaded aspect of they don't want you to be excited about what you're doing. And I would say for new people to like let yourself enjoy the small victories that you get. Yeah. Like I would love when I would have a student go out to a clinical and they'd come back and be like, guys, we took somebody to the hospital. Or I was working at the hospital and they were going to move the patient from the gurney to the bed. And the doctor looked at me and asked me to hold C-spine. And I counted and everybody followed me. Like they were so excited about that. And that was so amazing. Like that's what makes people want to do this for a long time. And there's a lot of people that I think can kind of shut that down. Like, who cares? But don't let them kill your joy in the little things that you find, especially when you're new. Because maybe 2 years in, you're not going to be super stoked about holding C-spine, right? But the first time you do anything is so cool, and that's how you that's what you find in this job that makes the sucky days suck a little bit less. Is like those cool little things that you get to do. Like there's been places I've walked into, I'm trying to think of anything specific. You walk behind the scenes of somewhere. You're like, people don't get to do this. I get to do this because this job is cool. Like, celebrate those little things, even if the salty old medics aren't, and don't let yourself become that person.
Right. I mean, like, kind of on Justin's note, like, I liken the same, or I say the same thing of like, you're gonna look at someone like, my name is so and so, and then you're gonna think, whiteboard, like it's going to be gone. I describe it as like, imagine the first time you started driving, the night before your first time driving a car, you're nervous, you're sweating, you're anxious. I don't know, maybe I'm just got problems, but I was all worried. And then now it's like, I'm driving. I'm like, oh, I have not been paying attention for the last 5 minutes. Where am I? Like it's easy to kind of get into the different headspace later. It just takes experience and exposure. And eventually, like kind of to your note too about, some skills being really exciting at first, then not. Like mine was IOs as a medic. I was like built this huge thing up. Like, okay, I got an IO, and then I did it. It was just, well, that was anticlimactic. It's just, but understanding these things are also probably not as scary as your brain's making them. Just do the dang thing.
Yeah. We train hard enough to get there. When we do it, it should hopefully be pretty easy.
Yeah.
But yeah, let yourself be excited about what you did.
I mean, the first time I did chest compressions on somebody, it was one of those like. It was a reflection of my training. I was like, oh yeah, we got the code compressions. I'm doing them. And it wasn't until like, I don't know, I'd counted, because we were doing the long count. I was at 80. And I was like, oh, this is a real person, like, this is crazy. But like, if you train hard enough and you get to where you got to be, it becomes second nature. And you'll realize it after you're doing something crazy that it's like, well, that was kind of neat,
Yeah. So I had some notes, and maybe we can start jumping into those.
Yeah, for sure.
Some things that. One thing I really feel like sets somebody that's senior and has done this for a while apart from somebody new is the ability to change directions mid-call. I feel like that's something that newer people really struggle with. And unfortunately, if you're new and you're listening to this, a lot of this just takes time, like you were saying, just time and effort to want to be better. But I feel like that's one of the big things that I've seen, especially as an FTO watching people learn, is like, you start your call, you ask your questions, you have your differential, here's what I'm going down, and you start going down that, like, no matter what happens, right? Like, the world's ending, it's still a stroke, whatever it is, right? No matter what else comes in, and an experienced provider is able to have a path, start down that path, and if new information comes in to make it seem maybe that's not it, they're able to divert the path, and then take in that new information.
Right. And that's kind of a disservice from just the unfortunate NRMT education we have to give.
True.
Like, we're not going to give you car crash caused a heart attack or vice versa, right? This is a medical, this is a trauma. And in reality, I mean, I'm sure you've seen it too, as you're proctoring an assessment, you see someone going down the wrong hole, and it's like, come on, man, like, just one question is going to relocate you. And it's cool when you see it, but it doesn't happen early. It doesn't happen often in school. Like, just transparently, a lot of people fail those scenarios, because you get so wrapped up in like, this is what I know, this is for sure, and then you're wrong. But yeah, like you're saying, the more experience you get, it's like, wait, hold on, what did you say? And then that one statement or sentence or symptom or whatever changes the entire situation, and being able to pay attention for that moment too is really important.
And I think too, like changing direction, stuff like that, and like I would train paramedics, EMTs, I would train them off of this kind of this closed loop system called the OODA loop. I don't know if you guys have ever heard of that.
Nope.
It's kind of like Fruit Loops, but it's
closed
OODA loop. But basically it stands for observe. So like, what are you observing, right? Like, what do you see? And we usually try to break it down that way. So like, what did you see when you walked into that house? Tell me, okay, orient. So orientation is like your education, your values, all that stuff, you're orienting to what you see. So you're seeing like, okay, how am I going to apply that? And then the next one is decide. You have to decide on that. So you base it off of what you see, your experience, all the other stuff that goes into it. Then you have to make a decision of, hey, what did you decide? And then you do an action. So OODA loop stands for observe, orient, decide, and act. And it's kind of this closed loop system. But when I'm training people, I kind of break down, it's like, hey, what did you see? And go through that process. Hey, what made you decide this? And they go back and be like, well, my paramedic instructor said this, or my EMT, or I thought this, I saw this call, so that's why I did that. That's why I decided that action. Okay, and then we could break it down and really work on it. And it's kind of a process I use of like, oh, did I do something? Did I see something and made a decision, but I weren't actually looking for the right things, right? It kind of gives me ability to backtrack the call, but also for my students too, to be like, oh, this is what I made that decision, right? Because, you're going to make the decision, but I want to know the why from it. And I kind of have them walk back of, hey, you did this action, what made you decide to do that action? Okay, was it, experience? Was it previous calls? Do you heard someone say, oh, I always do this? And you're like, well, that's got to be true, right? And then that way we correct a lot of stuff, because believe it or not, you're going to hear a lot of stories of everyone doing completely correct, but they don't tell you all the mistakes. So they're going to be like, well, this person did it this way, and that worked out really well for them, but they didn't actually tell you all the other things too. And so we kind of work through that whole experience, but also just helps them for when they leave, that they can use the same process of like, how can I always reevaluate myself? And I kind of break it off in those 4 steps. So
yeah, that's
I like
fair.
it.
I mean, kind of, so on the topic of senior people versus new people is their power of observation, I think is a huge differentiator, right? Because we've been in a couple situations like, ooh, this feels familiar. Look over there. There it is, right? And you can identify, like one example is, it's not mine, but it was my wife, who's also a medic. She was telling me this story of her walking in. Of course, it's a 4 a.m. sick person. There's 5 cars in the driveway. No one wants to drive them because they don't want to puke in their car or whatever. But she walks up and she's talking to this patient, and the patient's like, she's like, what hospital do you want to go to? And he's like, oh, I'm not from here. She's like, oh, you must be from Washington then. And he's like, how do you know that? The one license plate that was not Idaho was Washington. And so it's like, that's a minor little detail that no one really, it doesn't change a whole lot, but it's like, oh, they're looking for the nitty gritty little things. And same with like, paraphernalia on scene of a call. Like, it's like, oh, this reaction, there's the tinfoil, right? Like you can start paying attention to it, but newer people, they're so engrossed in the patient, they don't take that step back, which, comes with comfort, but that's a big thing I've noticed.
Yeah, that's like a muscle you have to train essentially. And the more you train it, the better it gets. But that power of observation definitely is a hard thing to train, that you really need to. And it's hard because, like you were saying, at first you're so focused on like, I got to say my name. I need to say my name is Chris and I'm an EMT, and that's my victory for the day that I got that far. Like you're not thinking about looking at those things. And you're going to probably get burned at some point because of it, right? You're going to start a code, and then somebody's, the next crew is going to show up, right? The fire crew is going to show up, be like, did you guys not look at the fridge to see the big DNR right there, right? You're going to miss something because you're just not there yet. And that's okay when you're new, right? Like, make sure if you're new to this, like you're going to miss that. It takes a long time to start to get to there. But then you're going to start to have those things where you recognize, you're like, oh, hey, I saw those medication bottles over there, and I was able to look at them and see that. Now I know why they're overdosed or why they're acting this way.
Yeah, or you're gonna notice weird things on a call. Like, this is, I don't know, morbid, but I had a 10-100 or a dead on scene for a gunshot wound to the head, and the weird thing was that there was a dead cat next to her, and I was like, why? What? I had so many more questions about the cat than what the patient was doing, but like, because the patient's pretty clear cut at this point, But that's like that observation thing of like, why does the situation feel so weird? And it'll sometimes be glaring. Other times it's not. You got to dig.
It's kind of a curse though too, because you get really good at it. So everywhere you go, even at restaurants, you're like observing everything. Like I go out with friends and they're like, hey, do you see that? And they're like, see what? I'm like, because you're just always observing, right? You're always watching people. You're watching exits.
Yeah.
Yeah,
like easy outs.
Yeah.
Every single person that walks by with like a CGM, a glucose monitor on their tricep, you notice because you're just so trained to look for those things all the time.
Or like a fun game that I used to play with myself in medic school is like I'd be sitting, people watching at like the mall and be like, I wonder if I can guess how many conditions people are predisposed to just by observation, which is totally judging a book by its cover and not entirely the best way to do it. But I used to also say we're paid to judge a book by its cover. You got to be good at that quick observation because that observation can be make or break for some people. Don't be super judgy, but like sometimes it helps.
I mean, I don't know. I'd be
pretty
judgy on scene. Yeah. I feel like as we say, if it walks like a duck and it quacks like a duck, it's probably a duck, right? So if you're seeing a lot of these things that maybe would be judgments, maybe there's something in that. That doesn't mean you need to base everything you're doing upon that judgment, but look around and see like, yeah, it's an overweight patient. Maybe there's going to be these things that they're predisposed because they're overweight or, whatever it is, right? Like, don't fall down the trap, but definitely use that.
I had one medic when I was brand new. She was helping me out with a lot of stuff, kind of FTOing, but she used to give me the task on every call when I was new. She's like, if you're not taking the call, I want you to look at this person and try to eyeball a body weight on them. And it was one of those things that was like, that's really mean. And she's like, it's relevant. And so then as you kind of progress, it's like, oh, okay. Because as we move into dosing and medications, it's like, well, if they're unconscious, I got to be able to spitball this a little bit. And that changed so much of my mindset.
100 kilograms.
Oh, yeah.
Everybody's just 100 kilograms. Baby. Yeah, 220 pounds.
And if they're less than that, they're 50.
Exactly. Yeah, everybody weighs in increments of 50 kilograms.
Oh,
about 110 pounds, more or less one way or the other.
I'm going to round up as needed too, or down.
Don't actually do that.
Don't. That's
definitely a joke.
100%.
Yes. Let's do a disclaimer right now.
Yeah. So another thing I had, which I think we've kind of been talking about, is just like seeing that whole picture. I think that's kind of a struggle, which I guess we've kind of already talked about this, but I had it written down. So, but yeah, seeing the whole picture, I think, is something that really separates somebody that's senior that's from somebody that's not, and whether that be medically or just like we were talking about, like scene stuff to scene safety, even the little things of you're walking up and maybe there's like, especially we're here in Idaho, right? Like the amount of guns that are just laying around that for me coming from California, that's like, it's just not as common, right? Like that's something I really had to start to pick up on. Seeing that whole picture of everything as you walk in is really important. That goes from what's on scene to like family interactions can tell you a lot about what's going on. Just taking all of that sensory input that you have and like synthesizing what you think is going on and how you're going to treat it based off of that. Don't just fall into the like, patient said they have chest pain and this is all I'm going to do, right? Like look at everything around you, take that whole picture in. And the experienced people are 5 steps ahead of everything based off of what they're seeing than the new person is, which, that just comes with experience, like most of this, of having done it a million times, that you can be that far ahead. Especially when you start to lead things, you can tell for step 1, I'm going to tell Justin to do step 1 while I'm thinking about step 3. I'm telling you to do step 2. Now I'm on step 5 in my head and kind of like, putting all that out there.
Yeah. I think as new, you learn how to set your filters too, right? Because you have so much information coming in from schooling, from what you heard to what the patient's saying. It's so hard to really filter out all that stuff. I think though, the more experience you get, you learn how to set your filters of, I can listen and figure out and pick out, this is what I heard this, and this. Okay, this helps me for this, right? But I think being new, it's really hard to really set your filters because, you have so many inputs coming at the same time that you've never learned how to actually filter out that information, the white noise versus the pertinent information. I think the experienced people have learned how to set their filters in a way that helps their practice. But this is how you get to your practice. You have to learn what filters you want to set on how you take care of patients.
Yeah, I feel like that's one thing I have a conversation with the students about all the time, right? Like if I were to be on a patient and my partner was reading vital signs to me, I'm not hearing numbers. I'm hearing normal, not normal. And everything that's normal just kind of goes out of my head. I don't need to think about that. If that heart rate's 86, that's probably fine. But when I hear that blood pressure is 86/40, that sticks in my head. Right. And sometimes that can be almost kind of a struggle, especially like dropping off at the nurse. You're like, the vital signs
with the normal limits.
With the normal limits, right? But I think that's good, setting those filters, because there is going to be a lot of stuff that doesn't matter. Like, cool, the patient takes 92 different medications. I think the most I've ever seen was like 68 that I counted. You guys probably something similar.
I don't think I've ever counted.
It was just like literal multiple pages. I was like, I just got to see. So I know it was disgustingly high. But that's an example of like, there's all this information that maybe could be relevant. I need to figure out, I need to have my filter on. Is this relevant or not?
Right.
And I can throw it away, right? Are they on, Viagra or something and it's a chest pain? That's really relevant. I need to remember that. But the fact that they take metformin doesn't matter.
Or they had gout in 92.
Yeah. I had my appendix taken out when I was 7. You're 84. Like, not relevant.
Yeah.
I mean, we've all had those moments, like you're just saying, it's like you process the information. And for me, it was like, don't care. Hold on, go back. What was that? And that happens even just with the scene stuff, as you're paying attention. Like, a big one example comes to my mind is like abuse type situations where you're like, not that necessarily we know abuse, but it's like, this feels kind of red flaggy and you got to pay attention to, okay, well, how are they acting? That seems kind of normal. Okay, I'm going to move past that, and like, but always kind of keeping that head on a swivel and paying attention to these little things. Because also understand that sometimes you can get duped and you're going to have to go right back to it. So the don't care is not entirely the best method in my head, but that's just what I did for like vital stuff.
And don't care is maybe not the right word, but just put it in a different box.
Less important.
In your mind, you have a couple boxes. You have relevant information, not currently relevant, relevant information, and work off that relevant stuff.
Yeah, that's what I meant.
Filter out the noise.
That's what I said.
It's all about the pertinent stuff.
Exactly.
Yeah. And you'll figure it out. And it just takes time, and everyone has its own pace, right? So never feel like, oh my gosh, I'm not as progressing as this other person who's in my cohort or doing this. Like, it just takes time, and every call is different. Like, you can't compare one call that someone ran to a call that you ran. Like, there's just so many variables, and I think a lot of times we expect like perfection right off the gate. And honestly, it's a journey. It's going to take some time to make mistakes, to be wrong, and also admit that you're wrong too, right? Like, I think in order to really, if you really care about this profession and want to go and be a great professional, it's learning to be wrong and admit that right off the bat, versus I think some people, get caught doing the wrong thing and then they make excuses. I think, or like this person, if this person or my partner did this, I would have done this better, right? I think the best thing to do is own it, because no one's perfect in this game. I mean, this is a practice. This is not a absolute, and I think we have to always be like, hey, if you screwed up, own it, because that's how we get better, right? You have, like, the people I look up to are probably the people who made the biggest mistakes in their careers. But those are the people who are like, yeah, I made the mistake, but this is what I've done better. And this is what the difference I have made because of that. And I think, talking to new people and letting, the older generation talk to the younger generation about their mistakes, and it's all right, and it's gonna feel bad, it's gonna not feel the greatest, but you know what, you'll get it. You just have to put that time and effort into it, and you will get to where I'm at, but you'll get it to your own way, not my way, but just your way. But you get to decide what future you want in this career, but take pride in that, because you own it, right? Like, at the end of the day, no matter what happens, whoever you get, organization you work for, at the end of the day, you own your own practice. So,
and it's always easy to couch quarterback a situation. Like you're saying, like, oh, I would do this so much better than my partner. It's the same thing. Like, I always had kind of a beef with QA. Like, I understand there's a lot of value, but when it's like, you weren't there, you didn't see, smell, interact, the same thing. Like, the reason I did this is because of the circumstance, right? You're couch quarterbacking. That said, listen to your QA folks. But, especially if you're working with friends who are in this field, and you're like, well, I wouldn't have done that. That's stupid. Stop. We all know that in the moment, heat of the moment, things happen, right? Choices are made, and choices are choices, and you got to live with it one way or the other.
Yeah, and I mean, I would say even about your own practice, like, don't do too much, like, the couch quarterbacking of your own practice, because you are going to make those mistakes. Just recognize what it was, and don't like nitpick yourself so much that you start to feel negatively about yourself or what you've done. Like Justin was saying, we're going to make mistakes. Just learn from it and try to make less mistakes tomorrow. And that's where we need to be, right? But, like, after you've done a call, as long as they got to the hospital, it didn't die, like, you probably did your job okay. And, find those big things and just don't be too hard on yourself, because that can be, you can really beat yourself up here.
Yeah, there's a line, right? Like, if you're planting something, you got to dig to create growth. sometimes you got to evaluate and like, oh, that did not go good and I wish I would have done something different. Well, next time. Create growth out of the digging you've done, right? Don't just waste the effort, because that's not going to do any good. I did think of a topic, though, that changes as you get newer to older. The amount of stuff in your pockets to how high your boots are changes as you get older.
Yeah, there's definitely like a converse relationship there, for sure.
You start with your Batman utility belt. I want my stethoscope. I want my fancy shears, and to make sure my name's engraved so everyone can see it, right? And then the 30-year medic's like, where are my loafers?
Yeah, no. I got gloves that I washed in the laundry.
Yeah.
They'll work.
Yep.
Laundry's disinfecting, right?
Yeah, that's definitely a true thing. I definitely I was on that track of like, the first boots were like tactical side zip, like real like fire academy style boots, and then I got to like softer boots, and by the time I left the field, it was like slip-ons. I don't know, Justin, were you a loafers guy yet? I know
I was loafers, yeah.
That's like, I feel like that's like year 15
Yeah.
is probably when you start to hit the loafer stage.
You made it.
Yeah.
Yeah.
You're allowed to. No one can
Yeah.
tell you not to.
Right.
Well, because you can slip it on a lot easier. You don't have to bend over. Bending over becomes hard.
Yeah, your maxilla destroyed.
Yeah.
Career in EMS.
Yeah.
You're welcome.
But yeah, all that being said, like if you jump on like Reddit or something, you're gonna hear a lot of trash about like new Reiki rescue stuff, which I have always been the like I've got my wallet, my phone, and some gloves in my pockets. I've never been the carry stuff kind of guy. Like if that's who you are, that's fine. Don't let people bring you down. If you wanna have that stuff, have that stuff. There's nothing wrong with it. Don't let people kind of ruin your personality here.
Yeah.
Maybe I think carrying Raptor shears all the time and spending $200 on this stuff is overkill. But if that's what makes you happy and excited to show up to work, don't let people bring you down for that.
Yeah, I mean, I was a pocket person. Like I had a pair of Raptors. Granted, I got mine on sale. That was the big reason. But I did have I was cutting leathers on a trauma with the ones provided, and the handle broke. And so I was like, that's it. I'm buying my own shears. Like my shears never failed me. All I had was shears. I used to, time of COVID, keep a N95 in my pocket as well. You just never knew.
A senior person works with people like that.
Yeah.
So they were like, hey, let me use your shears.
Yeah, that was a common one. Like, who's got scissors? I got scissors, and I got to track them down because you left them in the hospital room.
Yes.
Yeah, but on the flip side, right? Like, we know a guy who would have a IV bundle in his pocket. Like, I remember one of his students, because he taught here, was like, "Oh yeah, like how many IV bundles do you have in your pockets on shift?" None.
Not a one.
Yeah, and that was how he conducted himself and his students. And I think in their mind, anybody that was lesser was not as prepared and cared less. And don't let yourself fall in that other trap too of like, just because I was a little more lax about things, I still was very good at my job.
Yeah.
Right. Just the old school guy that had his loafers and the wash gloves. Like
A good day was having a pen too. I was like, oh, I have a pen also.
Always a Sharpie. I was that guy too.
no Sharpie. That's too much to remember. A pen though,
I mean-
that I usually found at the station when I got there.
See, I think I'm newer, so I was nervous, all the time. I was just getting transitioned to like, I think I want some slip-on boots, and then I couldn't try them on before my boot allotment came.
I would tell people too, like when I became a paramedic, it took me about 2 years to actually feel like, okay, I might be able to do this. Like it takes time because I was scared too. Like I remember being on shift and being like 2 o'clock in the morning, like, crap, I forgot the pediatric dose for Solu-Medrol. Oh my gosh, I better like remember that. Oh my gosh. And just realizing like it takes some time. And like I always tell people, like it took me about 2 years to actually start feeling comfortable. Like, okay, I've seen a lot of calls at this point, but now I feel like, okay, now I can take this to the next phase. And then, year 5, it's like, okay, I feel like I can get people to the hospital in one piece now. Like I'm doing better. And then year 10, I was like, I don't remember anything. What happened?
Yeah, I feel like year 1, you start to feel comfortable. Then the world just like the EMS guys just slap you real hard across the face and like remind you that you're new. Year 3, kind of maybe the same thing, but year 5, like you've been around enough to know what you're doing, but not to be arrogant about. Hopefully, to not be arrogant about it, so that you're not going to get caught flat-footed. But for me, same experience. It was like 3 years before. Like by then a lot of the calls came in as like whatever, but if it was like, like a respiratory call or like a pediatric call or like a cardiac arrest, it was like, still imposter syndrome like 3 years in. And that was as a medic. So that was like 7 years of EMS experience altogether of still being like, ugh. And to me, that was a sign that I cared and I wanted to do a good job. So if you are scared, even a couple years in, it probably just means that you have a high expectation for yourself and your practice. And it's not necessarily a bad thing, but it will get better. I think you will get to a point where you just feel like whatever is going to come, you've been there before and you can do it. And if you've never seen it before, you know how to make it work.
Yeah. I don't think I fell asleep. Like the first year and a half, I don't think I could sleep before shift that night. Like I was falling asleep consistently 2-3 in the morning because they'd be like, okay, if this shows up tomorrow, I'll do this. If this shows up, I'll do that. And then same thing of like, if this shows up, what's that number? And it's like I'm pulling up my phone to research at 3:30 in the morning. I got to be up at 6:30 for shift. And it's just you get used to it. But yeah, it's because you care, and that's nothing wrong with caring. Just take care of yourself at the same time.
I think that's another senior thing too, of like recognizing what resources you have and knowing that you can use them, right? Like you get through EMT school, and I feel like EMT, the level is a little bit lower. So you should like in perpetuity have all those medication dosages memorized. It's like five drugs, right?
Yeah.
But
6.
especially you get to like the paramedic level and you have pediatric doses and you have the IV infusion dose versus the IV push dose versus the IM dose. Like it's so much more. Recognizing like, I'm not going to have all this memorized all the time, but I have my protocols I can fall back on. And as long as I'm really good at that, and recognizing when I need to do the things I need to do, then I'm probably pretty safe, right? Yeah. That was one thing I really liked about the mentality of where we worked is pediatric doses. They didn't expect you, even the FTOs didn't expect you to have those memorized. They're so infrequently used that trying to memorize them is just a recipe for disaster, in my opinion, because you're going to, I haven't seen this dose in 3 years. I'm going to just try to do it off the dome instead of just pulling out your phone, pulling up your protocol thing as somebody's getting an IV ready or whatever and being correct about it. So, that use of resources, I think, is a more senior experience thing of recognizing you have those and when and how to use them.
By extension, though, I've run into, newer people in the use of your phone, right? Like I personally do not think if you're looking something up for the call, I'd rather be right. Take the 30 seconds to look at my phone versus I've had some FTOs are like, that's not appropriate. You don't pull your phone out on calls. It's not, but it's like, this is where my protocols live. This is where I don't know what that medication, it's so obscure or this condition. I'm going to Google it real quick, and I don't know, maybe I'm in a different camp than other people, but I don't think there's anything wrong with that. Be correct if you have the time. Make sure it's appropriately timed, right? Not like I'm midway through chest compressions. What was my number? Make sure you know what you got to do in the quick stuff. But if it's obscure things, use the information. You have all the world's information, that little black brick in your pocket.
I mean, yeah, to a level, right?
To a degree.
You shouldn't be having to pull out your phone and be like, what's the FAST assessment again?
Right.
You know what I mean? Like you should have most of it unlocked.
ABC. What does that stand for?
I've heard it's as easy as 1, 2, 3, but I just can't remember it.
It's the first 3 letters. I know that.
I remember when I started, and this is to outdate me, but like I had a little Palm Pilot. This was before like actually cell phones, but you were able to download like a pharmacology book. And I remember starting, and I remember getting like all these senior parents were like, you have to remember all these drugs in your head. I'm like, how do you do that? You just have to do it. And then I'm realizing like, it's impossible to know all the drugs. But like, I remember having my little Palm Pilot, and that's a time where the senior people were like, oh, these new kids, like, but it's just generations, right? Like my generation's probably gonna be like cell phones. Back in my day, we had tablets that we had to haul around of SWOs.
Yeah.
A dirty little secret that you might, I don't know if you were still around when this happened, but the department that will remain nameless implemented an FTO exam for people who are trying to promote to a protocol exam for people who are trying to promote to FTO. And to validate the exam, they gave it to the FTOs. Were you around when this happened?
No, but I remember.
And I think like less than 50% passed it the first time, which maybe there was a little bit of the fact, maybe because I when I promoted, I had to take it. And there were some that I was like, really, like, there was, like helicopter landing zone stuff. Like, come on, dude, really? We don't even do that. Supervisors do that.
Right.
But, dirty little secret that like we all have to look this stuff up. Like half of the FTOs did not pass a protocol exam. So like You know, everybody has those deficiencies and has to look those things up from time to time, and it's okay if you do.
Even doctors, think about it. Like, even doctors are like, and then they go back to their computer and they're like, these symptoms, you know, like they Google things just as much, you know. And
there's a reason there's a whole suite of medical books in the ER,
right,
or all for them to reference, right?
Right.
But like we said, there is stuff, and if you're a student listening to this, you're not going to be able to use your phone on your national registry.
No.
You better be able to come in with that national registry knowledge and crush it. But when it goes to real world, what's outside of that, like you have your resources and use them.
Control and own what you can control. If you cannot control it and it's something that's obscure and you're like, oh, I think we talked about this once, that's when we're talking. That's when I mean it's more okay. But yeah, if something you need to know, spend the time, you know. And that, I mean, frankly, you're not going to get to where you want to be if you don't. So
I think to add on to, especially being new, is it's all right to have strong opinions, but also hold them pretty loosely because you're going to learn a lot too, right? Just because you saw one chest pain doesn't mean that that's how old chest pains go. So always kind of be like, okay, I get chest pain, but also be able to adapt and, you know, hold those things that you believe very loosely so you can be open to other ways of doing it too. Just don't be like, I did this right, so I'm going to take this and apply it to this call. It never works out well. You try to double dip on calls, and then you're like, but it worked well this time. Like, yeah, that's great, but you're going to always have to adapt. So, like, don't just be like, well, I'm going to keep on forcing it. Like, really be open to, you know, asking you questions, figuring out your flow. And there's a lot of stuff to be learned on every call. You just have to take that action to actually learn from that call. Even senior people, right? Like, if you're not learning anything from any calls, right, like that's on you, right? You're owning that I'm not invested into, you know, learning anything about a person or learning about this profession or how I can do something better, right? You always kind of have to, you know, especially in EMS, it's really hard to stay motivated, but you have to have that self-motivation to kind of, you know, push you to become better.
On the kind of building on opinionated, if you're new, that's another one. I mean, I don't know if this is true, but this is how it felt for me when I started that department, was I had not earned an opinion yet when it came to a lot of things. Like, the department politics are going to be something you're going to deal with no matter where you go. They're going to have some variation of it. If you're new and you have an opinion, you don't always have enough information to really be there. Like, not to say that you're not heard or you're not validated, but think about it from a new person perspective. You're just figuring it out. You just got here, right? Like, if you sit at a dinner table with people and someone's like, hey, I'm going to be leaving first, but I'm going to order right now for everybody, you're going to say no, right? Like, it's the same idea. You have to earn a bit of an opinion, and sometimes keeping your mouth closed is going to be one of the most appreciated things, and you're going to take things away that you probably would not have if you'd been talking.
And match the energy level too.
Right.
I think that's gotta say, like, if you're working with people who just have a lower energy, right? But, you know, that's something you could observe. But, like, I remember a new person came in, we got done with our 24-hour shift, and we just got rocked. And this person's bouncing off the walls, like, eager, and like, how about this? How about this? And, like, I had to tell this person, like, I will answer your questions, but you gotta let me get coffee first. Like, hey, we'll get around to it, but just slow down. Like I haven't slept for 24 hours. Like, I know this is exciting, but like that will help you get a little bit further too, is kind of looking at your environment. And it's all right to observe, right? You don't have to have all the answers. You know, there's going to be a lot of questions, but we'll get to it. Just slow things down and kind of match the tempo. And guess what? You'll get a lot further too.
Like my dad would always say, take a breath and think before you talk. And it's something that is a lot easier said than done in a lot of moments, but it applies.
Yeah, I think a lot of new people just want to like be part of it and feel like they're part of it, and so they want to connect a little bit, and this is not a field to do that necessarily right off the bat, right? Like, especially you come work with a Justin who's been doing this for, 15 plus years, and you've been here for 15 days, and you're trying to like get on his level. It's just not gonna, you're just gonna embarrass yourself, honestly. That doesn't mean you shouldn't be excited and happy to be there, whatever. But like, you learn a whole lot more with your mouth closed and your ears open, and you're gonna learn a lot from these old dinosaurs, like the guy sitting next to me. I guess I'm kind of in that.
You're getting there.
Yeah. You're gonna learn a lot from us, but you need to keep your mouth shut a little bit. And maybe this sounds mean to people, but shut up, listen a little bit, and you're going to learn so much. And it's going to be willingly given if you have the right attitude and you don't try to like, oh, you had this call yesterday. Let me tell you about one of the 3 calls I ran in my career and how it's better. Right. Because we hear that a lot from new people that just want to be like, I'm excited like you guys are excited. But like, just wait.
And how you approach it too, right? Like, I think new people try to approach it very like, hey, what do you think about this? Do you think about this? And you like, I think sometimes senior people get kind of on the defensive, like, whoa, you're questioning me, right? I think, if you're going to be engaged and you want these answers, figure out how you approach some of those things. Like, hey, I'm just curious. I want to learn from that call. I saw you did this. Like, hey, can you like help me understand like what choices did you make to kind of get through that part instead of like, well, you did this. Why did you do this? Right? Like, if you always start with like, especially going to senior people and asking why, it kind of always puts people in defense. So like, figure out how to get rid of the why and more focus on, hey, I'm curious. I want to learn about this, right? So I think, approaching especially senior people and dinosaurs like me, right? Like how you approach it and the questions you ask will get different responses too. Because if I hear a why, I'm going to be like, well, this is why I did it and not really provide too much information. And like, what did you really get, right? You probably got maybe 2 sentences, but if you kind of ask me like, hey, I saw you on this call, this happened, blah, blah, blah. Like, what's your thoughts about this? Especially like even that as a new person, like, hey, as a new person, what things like looking back at your career, what things would you have done differently or what things would you put more effort into being new, right? And have them kind of provide, if you want some advice, that's always a good way to approach it is, coming into approach of, I want to learn, I'm more curious about this versus like, why did you do this?
Yeah. I would say on your note of like the stories, like this is a field of telling stories. We love telling stories. It's just part of
that's literally why we're here doing podcasts, because we love telling stories.
Telling you stories. But also understand, like, you've ran 3 calls in your career. Well, I ran this hypoglycemic, right? Like, not every story is worth telling, right? Reserve the few good ones. So those are the ones that's like, oh, did you have anything good today? No, it was stupid. We had XYZ. Stupid's not the right word. Use your words. But, figure out the moments to tell the right stories, because not all of them are really worth it.
Or don't be upset when nobody matches your energy about it, right? Yeah. Like if you're excited, like that's your first hypoglycemia, that's really cool. The first time that you get to see like, IV dextrose given and somebody go from unconscious to talking to you, that's rad. Like that's cool. You saved a life, right? But the person you're talking to has done that like 30 times in the last year. Right. So maybe don't be upset if they're not as excited about it as you are. Like I love hearing new people be excited. Like I think that's really cool. We're a different breed a little bit because we love this and we love education. But don't be upset when they're not as excited as you are, because it's not that they don't care. It's just not. It's an everyday thing occurrence for them. Right. Or for you, it's new if you're new. Right.
When you get the damn, that's crazy. If you start counting how many times they say that, you got to stop.
Wow. Oh yeah. Oh. Cool.
But that's why I think you guys should have, like, if being new, should have like a support group of new people, right? Where they can just go together and just tell all their stories together and be all hyped up, with their cool jackets and fanny packs club,
Well, yeah, I mean, and that we see that with students with like clinicals of like maybe they have stories that like to us is just cool, dude. That's a day on the job, but for them, like, oh, I did, like I was saying, like holding C-spine, I did this, and other new people are going to be excited. And if you're new and you can kind of have some buddies that are the same level as you, I think that's really helpful to share those experiences with somebody that will be more excited about it than some old salty guy.
Yeah. Embrace your groups of your classmates. Like, I'm a firm believer that EMS schooling and education is much better handled in groups. That's just maybe me personally, but also it creates a support network of people who really understand what you're doing, right? Like, it's not just, I talked to, not me, but some people, like I talked to my wife, she's an accountant. Say there's no frame of reference, right? Talk to people who get it. It's the same thing as when you're talking about your job with your coworkers versus talking to your spouse about your job. Your spouse is glazed over. Your coworkers are like, oh yeah, especially as you're using like those mnemonics and the little like fine like abbreviations and acronyms for stuff. If I said HTN to somebody just on like a lay person, they'd be like, okay, whatever that means, and it's the same kind of thought.
That's what I would tell you.
Yeah, you can do things that in your mind are like some slam dunk, and then people are like, so. But somebody else that gets it would be like, dude, you're a hero.
Right.
Like,
Create your own support network.
Yeah. Coming back to something that Justin was talking a little bit about, that I think separates new people from, somebody more senior. This is kind of in that questioning of somebody new and that they could feel like you're being questioned. When you've done this a while, you get really good at walking a weird line of being ultimately confident, but super humble at the same time. And I think to be good at this, you need to have the confidence to walk into a room in a crazy situation, take 10 different responders, tell them what to do and how to do it correctly, oversee all of that, and orchestrate this whole thing going on and have the confidence to do that, knowing you're going to do it correctly, but also being humble enough that if it goes wrong, you can adapt and change and you can try to be better next time.
Yeah.
It's a really weird thing. And so sometimes there's some ego you have to be a little bit aware of that. Sometimes there is that paragod mentality, which we need to have a little bit. Realistically, if there's a school bus that rolled and there's 12 seriously injured kids, you need to have an ego to show up and be able to function in this job. So there's going to be a little bit of that. But it can come out like you were saying if you start to there was somebody that we all know that was kind of notorious as an EMT of the way he would ask about calls very much was him calling into question the EMTs
condescending
the paramedics action. So don't do things that way. Just recognize that there is this fine line. And you're going to be way in the unconfident side initially. It takes a while to have that. I'm kind of like a swagger, right? Like you'll see that with experienced people. They just walk on scene and it's like no big deal. There's just this swagger they have. They're telling people what to do, asking people what to do, right? They're calm, cool, and collected. That takes a while to get to. But you still have to have that flip side of that humbleness that if something goes wrong, like you can fix it and you can learn for next time.
Right. Confidence and overtly prideful are different things. And I think you're right. You need to have that sense of confidence because we are the calm to the storm, right? I mean, an example, Michael Jordan, right? Like that guy is kind of a jerk if you talk to him, but he's one of the greatest to ever do it, And so it's one of those situations you have to have ego and confidence to be successful. And especially in a field like this where there's literal lives on the line from time to time, you got to be able to be that guy, but you also need to be able to understand, okay, this is a moment for me to stop talking and pay attention.
And I think also just to kind of say is like, we're all part of the same team also to remember that EMT, paramedic, advanced, remember it's a level. It's not, we're all the part of the same team. I see it all the time where paramedics treat EMTs horribly because they feel like they're more superior. That's got to stop. Like we're all part of the same team. Like we have to always remember everyone has a role to play and we should play it very well. But we shouldn't be like, well, you're at this level, so I think I'm better than you. Like, and also, if you're an EMT being treated poorly as a paramedic, that's not the paramedic, that's the person, right? It's not the profession. It's a person that thinks that they have the ability to do that. You know what? You've realized who you want to be and who you don't want to be. So remember, we're all part of that same team. And I think that's the most important thing when it comes to experience, not experience, is that if we're approaching this as a team, we want everyone to be great at this team because we're playing at a high stressful and a high competitive sport. And that's paramedicine. That's emergency medicine, right? We're playing at this high level. So we should have the best teammates to be a part of this team. And I feel like if we focus on that, it will help a lot of things that we do in EMS.
Yeah, the culture changes when we make it change and make it better, and we all need to take part in that.
Yeah, team sport.
Yeah, I think that's a good place to wrap it up.
Yeah.
So thanks, guys. Thanks for being here and having this chat. Like always, subscribe, smash the subscribe button, all that stuff. Justin, go ahead. Can you say it? I know you'll have to say it.
Hit that subscribe button.
There you go. If you got anything you want us to talk about, we always love to hear suggestions. One thing to address real quick, too, that we found out, we got some Buzzsprout fan mail, which is really rad. Thank you. But we're not able to respond to that. So hopefully if you're around, you're still hearing this. You stayed this long. But if you want to contact us, don't do it through Buzzsprout because we can't respond. You can send an email to info, INFO, at idahoacademy.com. We can put that in the description too. But if you want to, if you have questions, anything like that, we love to answer questions. You leave them in the YouTube comments, send an email to us. I'm on there actively on the YouTube answering questions and all that stuff. So If you have questions, send them over there. But yeah, smash the subscribe button, like, share it to all your friends, whatever. And we will see you guys on the next one. Thank you.